Hi, my name is Stefan Stanel. I'm a pulmonologist working in the UK in Manchester, and in this video I'd like to discuss about familial pulmonary fibrosis. So pulmonary fibrosis just means scarring of the lungs, and we say familial because it appears that in some families more than one family member is affected by a condition that causes scarring of the lungs. And we feel that this is really important because sometimes this condition may be more frequent than reported. And that is because when we go for a consultation, generally the consultation is quick. We are worried about our own symptoms. Our doctor may not ask us too much about our family history, but actually, if we delve deeper, it turns out that these cases are a bit more frequent than expected. And sometimes, actually, if you are seeing your doctor because you may have been diagnosed with pulmonary fibrosis or scarring of the lungs, it is worth mentioning if there is anyone else in your family with a similar condition. So in the case of familial pulmonary fibrosis, basically there is a genetic abnormality that seems to be driving the disease in several members of the same family. And what is interesting is that some family members may be affected by more than one disease. So it may not only be the lung that is involved. So there may be other conditions that seem to be linked together and seem to be present more often in the family. And some family members with maybe the same genetic abnormality may present with different conditions. So for example, they may present with liver disease, with frequent cancers in the family, different autoimmune diseases such as rheumatoid arthritis or scleroderma, lupus, etc. Or they may be on immunosuppressive medications for various conditions. Or there may be an unusual number of blood disorders in the family. So for example, many cases of anemia or cases of blood-borne cancers, so leukemia, things like that. Or there may be family members that experience early menopause, so say before the age of 45. Or even strangely, individuals in the family that seem to have gray hair at a very young age. So say they start to go completely gray or white in their 20s, which seems a little bit strange. And to make the matters more complicated, it appears that familial cases of pulmonary fibrosis also present atypically. So the pattern of fibrosis on a CT scan of the chest may actually be very hard to classify in a known pattern. Or there may be different family members with different patterns of disease, which is again very atypical, very unusual. Or such cases of lung fibrosis, they may appear at a younger age than we would expect. Or they may have a more rapid progression. Or they may have a worse response to treatment, especially to immunosuppressive treatments, which are often given in certain cases of pulmonary fibrosis. So overall, this topic is very, very interesting, and it's really trending at the moment because more and more information is being generated every day. And it's really important that you as a patient, if you are diagnosed with pulmonary fibrosis, come forward and talk to your doctor about other family members that may be affected by a similar condition to yours or any rare, strange disease. Because some of the patients who suffer with pulmonary fibrosis may benefit from genetic testing. And then subsequently, if an abnormality in the genes is found, genetic counseling and advice for the rest of the family concerning risks and predispositions to developing lung scarring or potentially other serious conditions. Thank you for watching, and in future videos I'll try to come back with more information about pulmonary fibrosis and other lung conditions.